A new partnership with Mercy One could help increase access to treatment for reproductive cancers in women in central Iowa.
KCCI's Abigail Curtin spoke with the provider to learn why he says these services are necessary. Abigail?
Well, in the entire state of Iowa, there are just 7 gynecological oncologists. 5 are in Iowa City, 1 is in Cedar Rapids, and just 1 is in Des Moines. The one here in Des Moines is now expanding his services to better serve a community that needs it.
Cervical, uterine, and ovarian cancers are just a few of the issues Dr. Kevin Kramer deals with on a day-to-day basis. But over the 4 years he's been practicing as a gynecological oncologist, his wait list has gotten longer and longer.
It's usually 6 to 8 weeks for surgery.
Iowa has the second highest cancer rate in the country. And Dr. Kramer says gynecologic cancers, particularly uterine cancers, are leading that drive. But there are only 7 gynecological oncologists in Iowa, none of which are in rural counties, and only 80 people in the country that graduate from medical school with that specialization each year.
Particularly in rural areas or states that provide care to rural patients. Those are harder places to recruit. People tend to want to congregate in larger cities. And so it just makes it difficult to provide the best care to these patients when, sometimes it's getting farther and farther away from where their home is.
That's why he's partnering with Mercy One to expand access to surgical and inpatient care while still providing outpatient care at the Iowa Clinic.
It's a small field, but one that's desperately needed.
It's not perfect. Some patients will still be sent to Iowa City simply because Dr. Kramer can't always treat everyone sent to him. But by establishing care in a new corner of Iowa,
we have a good chance of continuing to build something that's a very positive impact here in the city of Des Moines and central Iowa in general.
A program that he hopes will save or prolong hundreds of lives.
And now, while Dr. Kramer helps those with cancer, there's only so much that can be done when it's late stage, which means the best way to avoid needing to see him at all means staying up to date with physicals, pap smears, and other screenings. Stacey in bed.
Such an interesting story. Yes. Abigail, thank you.